Welcome to the eClinicalWorks podcast. I'm your host, Brian Hughes. On today's podcast, we'll be discussing eClinicalWorks' Helo telehealth solution for addressing patient specialty services remotely. This podcast is part of a series of podcasts which will be highlighting telehealth solutions that fit a number of medical specialty services. eClinicalWorks has made several enhancements to its software to cater to telehealth for a number of different specialties. Here with me today is one of eClinicalWorks' behavioral health subject matter experts. You may recognize him from our national conferences or at your local eCW day. Here with me today is Jimeet with the Business Development and Enterprise Strategy team at eClinicalWorks. Jimeet, thank you for taking the time to speak with me today.
Oh, of course, Brian. How are you?
Good. Well, Jimeet, over the last couple months or so, we've seen a lot going on, especially in the healthcare industry. And, over the recent months and some recent years, a lot of individuals in the healthcare industry have been talking about telehealth solution and how it can work for healthcare organizations. And certainly we've been thrown into the fire with telehealth. And, why would practices be interested in telehealth, and why are patients, demanding telehealth services?
So, Brian, it's funny you bring this up, but I've been demoing TeleVisit for past 2 years. I had one demo literally on, I think, March 1st of 2020. When I started doing TeleVisit demo, they told me that, it's a product of the future. We don't see it being used for the next couple of years. Reimbursement guidelines are not clear. And just fast forwarded by 15 days. Stay-at-home order came in place, and that changed everything. But having no workflow change, scheduling it the same way how they schedule appointment today, provider able to start the televisit by click of a button. So, if you talk about advantage, that there can be just many for all of us.
Right. And, ease of use for the clinician and the patient, is utmost importance when you're talking about, telehealth and remote connecting with your patients to, have that, visit with them. And, especially with the COVID-19 pandemic going on and healthcare organizations relying even more on technology, there are a lot of different vendors to choose from with, the telehealth marketplace. Mm-hmm. Now, talking about eClinicalWorks, what has eClinicalWorks done for practices, clinicians, and patients to be able to connect via televisit? And out of all those different vendors out there, what has made eClinicalWorks a top vendor?
If you think about it, we have built our product keeping 3 Ps in mind: the practice, the provider, and the patient. We have collaborated these 3 pieces in a way that gives one unique user experience. So question we need to ask is, does it include a workflow change from the practice side, right? Answer is no. The front office would make appointment the same way how they do it today. On the patient side, the patient gets a reminder, SMS or a text notification on the phone that your appointment starts in like 10 minutes. They don't have to download any app. They don't have to log on to any portal. They just click on the link that they get in a text, agree to the consent form that the practice has published, fill up any questionnaire that they have published, and just click on start the visit. If we look at this tight integration, which no other EHR vendor gives, who do you think is the winner, right? So having a functionality wherein they can use their EXE, they can use the browser, they can use an iPad app to talk to their patients using telehealth solution, which is completely integrated.
Right. One vendor, one solution for your telehealth solution is, it's very key. Exactly. And you mentioned a lot of great tools. You mentioned that, the questionnaire, taking pictures, all within eClinicalWorks, those sound like great features. Now, being a subject matter expert in behavioral health, what makes eClinicalWorks attractive with those features for behavioral health groups?
Like if you talk about behavioral health as a service, it's usually not offered like independently. It is offered in a multi-specialty group. Now, I have seen many non-ECW practices have different EHRs, one for primary care, one for dental, one for behavioral health. Now, do you know the amount of time and money they are spending on like documentation, training, maintaining these EHRs? And on top of it, we are saying that, they might be using a third-party televisit solution as well. So you can see, what's the difference versus now if we compare that experience with eClinicalWorks users, one integrated platform for all the users, right? Be it primary care, OB, dental, behavioral. The experience for all the users in the practice remains the same, with just few exceptions. So they are documenting the note the same way, they are entering the appointment the same way, billing the same way.
Now, would you be able to share any examples in terms of, some approaches that these groups have taken to adopt telehealth into their service, and, how they can change some of their existing appointments to televisit, and how do they help with that implementation and getting up on televisit?
Absolutely. So transitioning any kind of visit type to televisit was challenging in medical field in general. They are so much used to having patient in front of them, talking to them, but the crisis kind of enforced the use. And what the practices and patient realized was the advantage of using it, simplifying patient workflow to join through a text or an email without logging on to the portal or downloading any app made things very easier for the patient. Speaking specifically about televisit, onboarding on televisit is super simple. Like we can bring a practice up in 30 minutes. Talking about televisit with behavioral health, the practices who have behavioral health they usually document their patient's health risk assessment. They would fill up like questionnaire and document their goals, objectives, intervention, etc. And they can do the exact same things with the televisit solution as well.
And I'm sure the groups that you work with are trying to spread the word in terms of that they do have televisit services. And does eClinicalWorks have any nice complementary features to go along with televisit to broadcast to their patients that they are offering televisits, and it can be easy for them to make an appointment?
Sure. So, Brian, what I have been telling my customers specifically is think of this as a new service that you are adding to your business, right? I mean, and it can be any business, but if someone is adding a new service to their business, what are the different ways in which they can spread the word, right? And a few things that come to your mind would be, I can email my patient, phone call, text message, or I can send a mail out to the patient, right? But what if you have like a huge population, right? I mean, you have huge patient population and you just have to reach out to a cohort of patient population. How do you decide that? The next thing that comes to your mind is, I can update my website, make changes to it. And then third thing nowadays, obviously, is the most popular thing is social media, how you can not only tell your existing patient that you have this functionality, but how you can attract new patients that you have a new service, right? So let me elaborate on these 3 points that I just mentioned. Rather than manually going through the pain of calling every patient of yours and letting them know that you have this new service, why don't they automate that process, right? We have eClinicalWorks Messenger in our system. It allows you to build a campaign to send a text message, a voice message, an email message to this large patient population. Another thing a practice can do is update the practice website. So what we have seen a lot of practices doing is the first thing when you log on to their website, the landing page that they have, it specifically says televisit. So if you have a landing page as televisit, whoever comes to your website, they kind of know, okay, this practice offers a televisit. And then the cherry on top would be if they also offer a way in which a patient can make their own appointment. Just go online, book an appointment directly from the website. So the name of the solution is open access, where the patient can go online and make their own appointment for televisit. So, and lastly, use of social media to their advantage. So tell your patients your practice is one, it's open. If your patients are not comfortable, they can schedule a televisit with the practice. So they don't have to come to the office. They can do a remote visit. They can post short videos on televisit online, and obviously post educational documentation for COVID-19 or televisit, so that the patient knows that what are the different things the practice is doing as far as this current crisis is concerned.
Working with behavioral health groups, especially in the last few weeks, what are some of the things that you're hearing from customers regarding televisit, and what they've been saying?
The example that I like the most is Doctors with No Borders. You can, and especially at this time of the crisis, you want to talk to your provider. How can they easily be reachable?
Jimeet, I appreciate you taking the time, sharing some of your insights with telehealth and with behavioral health. And, thank you for taking the time.
Of course.
We'd like to thank you, the listener, for joining our podcast today. If you want to find other podcasts like this, you can go to iTunes, YouTube, my.eClinicalWorks or on our website at eClinicalWorks.com. On behalf of the eClinicalWorks podcast team, thank you for joining today.